What parameters govern implant success? Well, this is a simple one. We should be able to answer this one in about 3 days. Okay. And the truth is, I have recorded over 52 major categories that impact implant success. All right, and you guys already know what they are. From the patient's health history to the quality of the bone, the volume of the bone, the age of the patient, medications, how the implants are placed, where the implants are placed, the type of implant. You guys know all of these things, right? It just goes on and on and on. And when I say 52 things, when I say health history, I didn't dig down into health history and list all of those, because if we did, we'd be well over 100 individual criteria, if not more, that would govern implant success. And thus, this is why there is so much misinformation in the implant space, because people are looking at all of these multiple variables and they all play together, don't they? Right? They're not independent variables. They're dependent on each other, which means that when we have a failure as clinicians, we oftentimes don't know exactly what the reason was. And let me tell you, nothing pisses off people that are so compulsive that they go into dentistry more than not having an answer, right? This is not how we want to live. As dentists, we hate not having an answer, right? You're probably chuckling right now. Yeah, he's right. We go through school being asked questions over and over again, and the goal is what? The goal is to know the answer. And then when the patients ask us questions, doctor, why did my implant not work? Why did it fail to integrate? You want to have an answer. And the truth is, the vast preponderance of the time, the answer is what you don't want to tell the patient, which is, Mr. Smith, I'm not quite sure why your implant failed. No one wants to tell them that. But quite honestly, that is the main reason for a multitude of implant failures, which is you really don't know exactly what it is, except for the 4 main cornerstones for implant success. So let me explain what I mean. There are 4 things that if you do right, if you get these 4 things right out of the 52 that are out there that I've identified, your success rate goes up enormously. And the first one is going to be so painfully obvious that it's going to hurt. And the first one is location. The implant location is the single most important thing you can do. Just imagine for a second. You have an implant and it's surrounded with abundant bone. It has all the bone in the world. There's all the bone in the world, right? So it also has a 3 millimeter collar of attached keratinized gingiva around it, right? All around it. It's got this beautiful mucosal tunnel of attached keratinized gingiva, right? What are the chances of that implant not working? You go, that's going to be great, right? I mean, it's not going to fail, right? Because it's got so much bone and so much soft tissue around it. You instinctively know, if you've done implants, you know, that's probably not going to have a problem, right? It could, but the likelihood of having a problem goes down dramatically. Now, let's turn that around. Let's say it's placed and half of the threads are not in bone, okay? And it doesn't have keratinized gingiva around it. It has just mucosa around it. What are the likelihoods that you're going to have perimucositis or periimplantitis? You're right. You're thinking right now, yeah, pretty much every case that I see. And now you're thinking, well, wait a minute. Was the bone loss caused because of the periimplantitis, or was the bone loss caused of periimplantitis? Well, in my experience, it's the latter. And what I see is I see poorly placed implants where the implant is not in, quote, the bone. Part of it is out of the bone. It integrates. It even is restored. And a number of years later, they have issues, right? And then we say, well, did we lose the bone, or was the bone not there? In most cases, the bone wasn't there in the first place. The implant was placed poorly. And what that did is that just started the match, almost like Mission Impossible. When the match starts at the beginning, it starts burning, and then it just finally causes a problem later on, right? So you've got to get the implant in the right location. And if you do, your likelihood of having troubles goes down dramatically. The second most important thing that you could do for placing a dental implant is place a reputable dental implant. And this can be quite shocking to people, because pretty much any implant that you're placing, you believe is the best implant, right? Because it's like, That's what you're doing. So you have confirmation bias and you say, I believe that the implant I'm placing is the best. But quite honestly, all implants are not created equal. And most people don't know the differences. They kind of think they know the differences, and they've been sold by the salespeople at the superficial level. But when we break down all of the reasons why you would want to design and or use a dental implant, it's shocking to people when they realize that their implants are made and the threads are on the backwards, or the threads are actually causing 6 times more stress to the bone than some other implant, and they don't even know it, because the salespeople don't talk about those things. They talk about the superficial things that get us to buy these things. So implant design matters. Implants are not a commodity, and you must take your time to analyze the implant in detail to determine whether or not you believe it's the best implant for your patients. And the other 2 cornerstones are covered in the class. They're not as significant as the first 2. The first 2 are by far the most significant things, but they're still very, very important. If you want to learn about those, come to the class. I'm Dr. Robert Stanley, Smile Engineer. If you've enjoyed this video, give us a like and subscribe for more.